hello, I'd like to introduce you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village. I also am the co-host on the show It's About You on WKYC Channel 3, where weekly I recognize people that are doing some great things in our community. However, this web series is about you. Yes, it is. It's about your health, and it's about making sure that you continue to stay healthy even during a pandemic. You know, as a leader in the community, I felt it very important to make sure that we share with you all the wealth of information that you can receive from university hospitals on how to live a healthier life. And so today I'm pleased to introduce to you Dr. Amy Schell. She's here with us today. What's our topic for today? And also let us know a little bit more about you.
Hi, thank you so much for having me. So today we're going to mainly be focusing on obstructive sleep apnea, which is a very, very common problem in a lot of our patients. Just to introduce myself a little bit, I am a physician at university hospitals. I'm in the ear, nose, and throat surgery group. And so I'm ear, nose, and throat surgery trained, and I'm also trained in sleep medicine. So my focus of my practice is treating patients with obstructive sleep apnea, among other sleep problems, and treating that problem both medically and surgically. And we're gonna kind of delve into those topics today. So thanks for having me.
Yes, I'm excited about it, but let's just start out. You gave me a word. What is obstructive sleep apnea?
Sure. So obstructive sleep apnea what it is in the name. So when we all go to sleep, our muscles relax, and that includes the muscles in the upper throat. And when that happens when we're sleeping, if it happens too much, it actually can keep the air from getting from the outside world down into our lungs. So when we sleep, those upper throat muscles can either completely or partially close off, and that can lead us to have trouble breathing at night when we sleep. Now, a lot of people will kind of, their brains will wake them up to get them breathing again. And so what we do is we sense this obstructive sleep apnea often as unrefreshing, interrupted sleep. We sense it as snoring. Sometimes people notice that they're actually choking or gasping, or their bed partners tell them that they've stopped breathing in their sleep. So it can lead to a lot of impaired daytime functioning, not just for the patient, but also actually for their families and their bed partners.
Wow, I'm sure. Now, are there any other things outside of that can affect your sleep?
Oh my gosh, yes. So when we think about sleep health, especially in the ear, nose, and throat world, we often get distracted by obstructive sleep apnea. But the reality is that OSA, or obstructive sleep apnea, is only one of 60 sleep disorders.
Oh, wow.
And though obstructive sleep apnea is extremely common, it can be present in upwards of 10 to 20% of certain groups of patients. There are other sleep disorders that are even more common than OSA. And especially now in COVID times, a lot of patients are struggling with insomnia, or the inability to fall asleep or fall back to sleep if we wake up at night. That's an extremely common disorder, present in upwards of 40% of people at some point in their life. There are also different movement disorders of sleep, like restless legs. And lastly, many of us simply just don't get enough sleep. The National Sleep Foundation recommends that we truly try to get the 7 to 8 hours as adults. And I can tell you for sure, there are so many of us who are not quite getting enough sleep. I can tell you from my personal experience with a 4-month-old, I'm definitely in that group. So sleep health on the whole can be related not only to OSA, but also the inability to fall asleep and simply just not getting enough of it.
Wow. So how do you diagnose if you may think you have, obstructive sleep apnea?
Sure. So the history that I get from my patients and from those who hear them and witness them sleep is extremely important. So we did mention before, a lot of OSA patients will tell you that they snore, that they wake up with choking and gasping, that people notice that they pause at night. That they wake up sleepy and unrefreshed. But the only way to truly make the diagnosis is with a sleep test. And there are a couple of ways to get sleep testing. So in the past, the only way, and still the gold standard way of diagnosing OSA, is coming into a sleep lab and actually sleeping overnight. You have sensors put on that assess the brain waves of sleep, the movements of sleep, and the breathing of sleep. And with that, we can get an idea of whether or not the patient has OSA, and if they do, how bad is it? Another way to commonly test for sleep apnea now, especially in patients who are otherwise relatively healthy and don't have any of these other sleep problems that we're mentioning that are significant, is with a home sleep test. So patients can actually get these kits at home where they often wear an oxygen sensor on their finger. They'll wear a little airflow sensor by the nose and the mouth, and then a stretchy belt around the chest that senses how hard they're trying to breathe. And they can actually sleep with that in their own bed, in their own environment for a night. And we can usually get a pretty good idea whether or not they have OSA or obstructive sleep apnea and how bad the problem is.
Well, that's amazing. Now you can do it at home. I mean, I think there's no
Yeah,
excuse down to, if you shouldn't get it checked out if you feel like you have a problem. But the next thing I'd
absolutely.
like to ask you is, how do you treat it, Dr. Schell?
There are a lot of different ways to treat sleep apnea, and it's always really interesting to me to think back. We've actually really only been treating this problem and diagnosing it since about the late 70s, early 80s. So it's a very young field, and the treatments for OSA continue to expand and evolve. So again, kind of the original gold standard way of treating sleep apnea is with something called a CPAP, or sometimes you'll hear a BiPAP. But what that is, the PAP, P-A-P, stands for positive airway pressure. So it's basically air pressure that holds that upper throat open when it wants to flop closed when we fall asleep. So kind of like you might pick up a floppy balloon and blow just enough air in it to hold it open. That's what that machine does for the upper throat. About half of people can do well with those, and then the other half of people really struggle to get used to them, to be able to wear them while they sleep, or to be able to achieve benefit with them. So that's when we get into some other therapies. I'm a surgeon by training, so we'll discuss that as well, but there are other non-surgical therapies that can be considered for sleep apnea. For instance, weight matters for almost every OSA patient. As the weight goes up, sleep apnea tends to get worse, and as it comes down, it tends to get better, and sometimes weight loss can even cure the problem. For other people, sleeping in certain positions can actually fix the problem for them. Most are worse when they're flat on their back than if they can get their head of their bed up or get on their side. Lastly, there's even some evidence that doing exercises for the upper throat can help. So exercise seems to help everything.
Yes.
And doing upper airway or upper throat exercises can be helpful. Smoking and alcohol use can make sleep apnea worse, so avoiding those things can be helpful as well. Now, getting beyond just those kind of lifestyle modifications, I work very closely with sleep dentists who actually can make oral appliances custom fit for patients who may have more mild sleep apnea. That can be very helpful. And then when we get into the surgery realm, there's different types of surgery. So there can be surgery done inside the throat to try to make it more open or less collapsible. That would be like something like taking out the tonsils or trying to reduce the size or reorient the way the roof of the mouth or the back of the tongue might look. There's bony surgery for sleep apnea. So the actual jaw structures can be moved to create more space in the upper throat. So I like to talk about, it's not only about the size of the furniture inside the room, but the size of the room itself. So jaw surgery would actually be like knocking down the walls and making the room bigger. And then now there's another type of,
Go ahead. I'm sorry.
Oh, I was just saying there's another type of surgery that we'll talk about in a little more detail that actually doesn't involve rearranging anything in the throat or the jaw structure. It actually involves stimulating the upper throat to open up while we sleep.
Gotcha. I was going to ask you about that, about the whole stimulation piece. I think they might call it inspire surgery. Can you tell us a little bit more about that?
Yeah, so this is something a lot of my patients come in asking me about. It's online and on the radio a lot, and so people want to know more. It is a surgery that's actually been approved by our FDA since 2014. And it basically is a pacemaker for the upper throat, and it looks like a pacemaker too. a small battery pack that actually sits in the upper right chest. And then we make a second incision up under the chin, where we go in and we find the nerve that runs our tongue muscle. The tongue muscle is this huge structure that's attached to a lot of different parts of our upper throat. And so if we can get that tongue muscle to move out of the way, it can often open up the throat pretty nicely. The device has a third incision down by the rib cage on the right side, where we put a little pressure sensor that senses when the patient's trying to breathe in. So all in all, that system, about a month after it heals in there, the patients get a remote that they turn it on with. And then literally every time they breathe in at night, the tongue is actually going to be stimulated to move forward and move out of the way of the upper throat.
Wow, that modern technology is amazing. But again, the
Yeah.
end result, Dr. Schell, is a good night's sleep. And tell us how
That is our
important,
hope.
reiterate how important that is.
Absolutely. We're supposed to spend about a third of our lives sleeping. And so
Wow.
it's so important to focus on sleep health. And there's a lot of data to, support that it's related to so many aspects of our health, whether it be our immune systems, our cancer risk, and other things. And so we're learning more and more, and we really only know the tip of the iceberg now in the sleep world. But we're slowly making our way there. And it's important to know too that it's not all about treating the sleep apnea. It's about treating the sleep health on the whole.
I love it. So sleep health, again, could be correlated to immunity, can also be correlated to cancer and other ailments in the body. So that's
Yes,
why it's so important if you see this challenge
absolutely.
in your life to get it checked out. So Dr. Schell, before we go, can you let us know how we can reach you and find out more information about sleep health?
Yeah, so there's actually a pretty great number for the sleep services at university hospitals. I'm only one of a multidisciplinary team that includes other sleep physicians that are family medicine doctors, neurologists, pulmonologists. We have a sleep psychologist who helps with sleep health, both on the pediatric and adult side. The number to reach our team is 216-844-REST, REST. And that can lead you to any one of our providers. I myself I operate at the Richmond Heights Hospital, and I see patients in Beechwood, South Euclid, and out at Parma.
Okay, sounds good. Well, Dr. Schell, I want to thank you again for expanding our knowledge and sharing with us how University Hospitals is working to build a healthier you in all of our communities. And so that'll be our segment for this week. And I want to thank all of those that are watching for tuning in and seeing all these resources that are available to you. Make sure that you contact me on social media or visit my website at larrymaconjr.com, or for further information regarding your health or any concerns, make sure you contact University Hospitals. They're doing a great job to manage the health of our community. And so again, I want to thank you, Dr. Schell, for being on the segment.
Thank you so much for having me.
Thank you.